Picture this. The entire U.S. government is frozen in a standoff, leaving millions of Americans in limbo. And the potential key to thawing things out lies in a heated debate over healthcare subsidies. It's a situation that's not just frustrating for politicians, but could hit everyday folks hard in their wallets and daily lives. But here's where it gets controversial. Senate Majority Leader John Thune claims he's extended an olive branch to Democrats by proposing a vote on extending Affordable Care Act premium subsidies, all in an attempt to wrap up the ongoing government shutdown. Yet, as we'll see, it's sparking fierce disagreement on whether that's truly enough to break the deadlock. In a candid chat on MSNBC that aired Thursday morning, you can check it out at this link, https://msnbc.com/morningjoe/watch/Thune considers future vote on extending healthcare subsidies 250-0035258. Thune, speaking from an interview taped the day before, laid it out plainly. He told Democrats he'd make sure they get a chance to vote on beefing up those subsidies, which help many people afford health insurance without breaking the bank. But here's the catch. He couldn't promise how that vote would turn out. I've been clear with them, he explained. We're open to talking it through. If they want to vote, we can set a firm date for it. At some point, they just have to accept a yes and move forward. For context, if you're new to this, the Affordable Care Act, often called Obamacare, is the landmark 2010 law that expanded health insurance coverage and included subsidies to lower costs for moderate-income families. The shutdown, now stretching into its 16th day, refers to when Congress hasn't passed enough bills to fund government operations, leading to furloughs and disruptions. Democrats, led by figures like Senate Minority Leader Chuck Schumer, are holding firm on demands for tweaks to this system. Why? To prevent what they see as a looming surge in premiums that could make healthcare unaffordable for low- and middle-income Americans. Without these fixes, they're reluctant to back funding bills that would restart the government. And this insistence hasn't wavered, even as the shutdown drags on, causing real harm like delayed paychecks for federal workers and stalled services. The Senate has already shot down the GOP's government funding proposal 9 times this week alone. Now, on Thursday, another attempt is slated, but Thune's shifting tactics. Instead of directly tackling the shutdown, he's pushing a procedural vote on legislation that would fully fund the Department of Defense for the entire year, ensuring troops get their pay. This is a smart move because it kicks off what's called regular order in Congress, a more traditional, step-by-step process for passing spending bills rather than rushed all-or-nothing votes. In simple terms, regular order means committees debate and build bills from the ground up, leading to more thoughtful decisions, unlike the emergency measures often used in shutdowns. Thune hinted that if this DoD package sails through, he'd work to attach funding for other agencies using that same regular order approach on the Senate floor. Restarting the government is essential, he emphasized in the interview, as it's the foundation for any real talks on healthcare reforms. He'll commit to discussions, but not to specific results. I see a way ahead, but it must involve changes, he said. Can I promise it'll pass? No, and that's what folks are after. Assurance that this will succeed. Instead, he offers a process and a vote guarantee. When asked about Thune's stance, House Speaker Mike Johnson echoed the sentiment during his morning press briefing. Leader Thune can't vow any particular healthcare results to Chuck Schumer, he stated, because we haven't wrapped up those talks yet. It's as straightforward as that. On a positive note, Thune pointed out there's agreement across party lines to keep healthcare expenses manageable. Yet he stressed that adjustments to the program are necessary, and those negotiations can't even begin until the shutdown ends. And this is the part most people miss. It's not just about politics. It's about finding common ground to protect everyday Americans from skyrocketing costs. Perhaps through examples like capping premium increases or expanding eligibility for subsidies. Diving into the nitty-gritty, Thune addressed concerns from Democrats about the White House's use of rescissions. That's when the president cancels or reduces funds that Congress has already approved. Democrats argue this undermines trust in funding deals, making cooperation tougher. Thune didn't outright demand the White House halt rescissions, noting it's a constitutional power of the president. But he pushed for the preferred path. Regular order appropriations. We need to chat with the White House about this, he said, having already had those talks. A standard funding process where everyone feels involved benefits all, including the administration. Meanwhile, as Thune gave this interview, the House was deep into its third straight week of recess, basically a break from official sessions. Asked if it was wise for them to stay out of Washington, Thune called it a call for Speaker Johnson. "Nothing urgent is happening right now," he replied. "They've done their part by passing their bill. The ball's in the Senate's court." And speaking of timelines, Thune couldn't promise a quick resolution. When pressed on whether the shutdown might linger until Thanksgiving, he hedged, "I really hope not, as that would cause immense hardship for Americans." This whole saga raises big questions. Is Thune's offer a genuine compromise or just a way to shift blame? Should Democrats trust a process without guaranteed outcomes, potentially leaving millions exposed to higher premiums? And what about those rescissions? Are they a fair tool for the president, or do they erode congressional authority? We invite you to weigh in below. Do you side with the Democrats' demands, or do you think the GOP's approach is more pragmatic? Could this lead to meaningful health care reforms, or is it doomed to more gridlock? Share your thoughts and spark a conversation. We want to hear from you.